Hi everyone, Dr. Kerry Yerke here. Thanks for joining me today. I'm a chiropractor in Kelowna, and today I'm talking about knee pain relief without surgery. So if you're suffering from knee pain, this is something we see in the clinic a lot. And in order to stop suffering from knee pain, you need to take some action to get rid of that knee pain. And in the clinic, what we do is assess the knee to see what kind of condition it's in. Uh, that's by doing a history and an exam. Sometimes we'll take some x-rays on the knee. And then we want to see what we can do to restore the knee back to good health again. That's the alignment of the knee, the function of the knee, the soft tissues, the joint alignment. And then we also assess the areas above and below the knee as well. The hips and the feet, they're very important to the knee. So I get these questions all the time. Is knee pain just part of getting older? No. I mean, I've been running for 30 years now. I've done over 25 marathons. Right after this video, I'm heading out for a run. And I had a lot of knee pain when I was a teenager, actually. And since then, my knees have been actually a lot better. Chiropractic care helped that when I was a teenager, but subsequently, just staying in good shape, getting the proper help, and nutrition, exercise, all very important. So knee pain isn't just part of getting older. Of course, as you get older, your collagen changes, so you can be less elastic. And so, yeah, it can change the rehabilitation time, can change what you're able to do with your knees, but it doesn't mean that you have to have knee pain. If my MRI shows arthritis, am I stuck with knee pain? No, the two are not synonymous. MRIs do show a lot of detail in the knee, but yet I've seen people with MRIs and x-rays that have looked bad, and yet they don't have that much knee pain. I've seen people with pretty good looking x-rays and MRIs, and yet they have quite a bit of pain. So it's more than just the imaging. There's a lot more to it than that. Should you stop exercising if your knee hurts? That depends. I would say the simple answer would be yes, but you can't stop exercising and just do nothing. So often I'll have people come to the clinic and I'll assess their knee and I'll say, don't exercise for the first week or two. We're going to do some intense treatments, daily treatments every other day. We're going to get your knee feeling better quickly. And then you can start to do some exercise. I'll give you some stretches to do at home, and that'll really help you. So, it all depends as far as what exercise you're doing, what kind of condition your knee's in, and what you're doing about your knee pain. Now, if you want to come to our mastermind class or our webinar, it's at the end of the month, and it's going to be on knee pain and how to get rid of knee pain without surgery. So you can scan this QR code, go to our webinar. Also, you can take one of our mastermind classes after the webinar. We're going to have 4 mastermind classes, 1 a week for 4 weeks after the webinar. There's some VIP bonuses you can buy, some tools and resources that go along with the ticket sales, and then some one-on-one coaching that's available to help you. Specific recommendations for your knee, also some accountability to make some changes to help your knee. So I want to encourage you to scan the QR code to come to this webinar. The webinar is coming up on January 29th at 6:30 p.m. Pacific, 9:30 Eastern, and you can scan that QR code to get a ticket for this event. If you have any questions, feel free to write them in the comments. Subscribe to this channel and like this video, and I'll talk to you guys soon.